This video is going to demonstrate non-invasive positive pressure ventilation on the Revel ventilator, and we're going to specifically look at our BiPAP mode. It's important to know that your BiPAP or CPAP on the Revel ventilator need to start in the back menu on the initial startup. There's aspects to those modes that are very specific to starting actually in Nppv. So what we're going to do is we're going to scroll to new patient, hit select. I'm going to scroll over to patient size. I'm going to hit select on adult and scroll over to Nppv. So I'm going to hit select, and we can see that our initial IPAP default is 16. So that's the first thing you need to identify is what is the patient currently on, or are you establishing this for your patient? So let's say the hospital that you get this patient from says that they're on an IPAP of 12 and an EPAP of 3. So what we want to do is we want to hit select. We want to lower this down to a total IPAP of 12. All right, we're going to hit select. We're going to scroll over now to EPAP, hit select, and we said we wanted a total IPAP of 12 and an EPAP of 3. Okay, so now we can say we have an EPAP of 3. We can add those two together because this is additive, and you can see that 3 plus 9 is 12. So your total IPAP is 12, your EPAP is 3. We hit select, we use our knob, we scroll over to our rate. The rate on the Revel ventilator when you're in the startup menu here is not the backup apnea rate. I think that's a misconception. Your actual backup rate will show up here under breath rate. This is a rate that actually augments the patient's spontaneous breaths. And so if you identify your patient, even though they're conscious, they're alert, they're fatigued, they may need a little bit of support, you can actually set a spontaneous augmentation rate of whatever you want. And so let's say for this demonstration, we're going to use a rate of 12. So we're fine with that. And we're going to hit ventilate. Okay, we're going to turn our alarms off just for the demonstration purposes. I'm going to use this yellow button at the bottom and clear those alarms off so we actually see what's going on. And you can see that a few things have happened. Because we set that spontaneous rate that will actually augment the patient's own respiratory rate, you can see that our pressure control knob or button is actually lit up. And so that's what's actually driving the patient's augmented breaths based on that respiratory rate that you set on the initial startup. You can also see that it's actually blinking. And so there's some recommendations based on Carefusion that they say that we should set the ventilator up based on standard parameters for every BiPAP patient. And you can identify the need by looking at the pressure control button. If that's blinking, that means that what's called the flow termination is set too low. And so all we need to do on every patient, once we're in this mode, we're actually ventilating, is we're going to hold down the select button for about 3 seconds, and it pops up standby. We're going to use our knob. We're going to scroll over to our vent control. We're going to hit select. You can see now, we can see rise time, and that's where our flow termination is. The flow termination for a BiPAP patient needs to be 35 to 40%. The Revel defaults at 25%. So we're going to hit select, and we're going to turn this, for purposes of this demonstration, to 40%. We're going to hit select. We also want our time termination to match whatever our I time is. And your I time on any BiPAP patient needs to be 0.8 to 1 second. And so it's actually at 1 second right now. So what we want to do is hit our time termination, hit select, and we want to turn this down and allow it to match. Hit select, and now our time termination matches our I time. Time termination is the time where any pressure supported breath is terminated. And so why would we want a pressure supported breath to be longer than our standard I time? That doesn't really match. So we would want to make those two match in this setting. anytime you change anything on here as far as your IPAP or EPAP, you always want to make sure your pressure control matches your IPAP. So if we turned our IPAP up and we wanted that to now be 12, so total we would be 15 over 3. We would also want to turn this up to 12. And that is all there is to it. Again, very, very important to always start in the NPPV mode. Always select your backup rate, right? It's not an apnea rate. That apnea rate is defaulted at assist control at 12. But set that other rate because that really will help the patient. It will assist them. Remember to always set your flow termination to 35 to 40% and set your time termination to match your I time, and you should be golden.